What do we mean by that? You know, a milestone event or a landmark event is something that changes the behavior of how we operate in the marketplace or within our own practices. So let's consider for a moment a change of an indication of a drug that exists today. All of a sudden you open up the world for new treatments for a particular disease state. Think about a landmark study where you now have improved patient outcomes, such as improved overall rates of survival for cancer patients. These, of course, are milestone and landmark events. Now, I would also say, if I can find the clicker, yeah, there you go. Thank you very much.
Oh, you have not got it. You can keep the second one as well.
One in each hand. This is like playing Nintendo video games here this morning. Great. So I would say to you that biosimilars, I believe, are really a milestone event because they have the ability to change the behavior of how we treat patients, either currently today or in the future. So if you think about that, as a biosimilar coming into the marketplace, what is it going to do? It will change the behavior of how we treat these patients, but more importantly, it will allow us, as I think everyone can unifiedly say, it provides additional access and affordability for patients. So the road ahead is a very long one. We'll talk a little bit about how many biosimilars are approved today in the United States. I believe it happens to be 5. But think of the time and effort it took to get those 5 products here. As Asif showed you, there are multiple biosimilars all over the world. But clearly, by definition, they have to be products that are approved through the regulatory pathways from the EMA and other regulated markets like the US, Japan, New Zealand. So with that, we'll talk a little bit about the road, the journey for biosimilars today, current status, very brief. We'll then talk about some of the detours. As manufacturers, we're always at the verge of trying to understand what the new guidelines are. This interchangeability guideline has gone back and forth for several years now. I can tell you, having been in this area for about 11 years now, I will tell you, we constantly looked at what will the final guidelines be for interchangeability. Now, let me be perhaps a little bit provocative. Does it really matter? Does it really matter in the United States with the multiple stakeholders, the wholesalers, the PBMs, the GPOs, the specialty pharmacies, does it really matter if they utilize certain tools to prevent the use of other products? Interesting question. For sure, from a clinical perspective, interchangeability is incredibly important, as is perhaps substitution.